My name's Anirudh Kumar, and I'm a cardiovascular surgical resident in downtown Toronto. And besides work, I really like to just sit and meditate and play with my dog and hang out with my friends. And I also like to work on my research study when I'm not working in the operating room. Yeah, that's about it. I have 5 minutes with a patient and I have to connect with them in those 5 minutes. And I think facial expression and really being able to look into someone's eyes and the entire gesture of a conversation is very important. But with COVID-19 and with the 6 feet apart and social distancing protocol and the masking protocol, it seems like patients feel a lot more reserved when it comes to conversations with doctors, let alone even stepping into hospitals to see their physicians. So I believe it's impacted the way I provide care to my patients. But I think furthermore, it also hits closer to home because I do have to go back home and see my parents. And my parents are old as well. So it's kind of the dynamic between making sure that I'm able to provide care to my patients during these times, but also making sure I don't bring it back home. And I think the constant struggle between both worlds is is uh, is quite stressful. It's kind of helped me look into the cracks that we have in our current healthcare system, just not in Canada, but across the globe. I've been working with a few folks in Toronto to kind of look at how data is being shared amongst physicians in the city of Toronto and across the globe. And I believe that if we did have regulations in terms of data sharing, we could have potentially caught the pandemic much earlier or prepared ourselves better. So I think work life, it really tells you and shows you the cracks in our healthcare system when it comes to really serving our patients and preventing pandemics like this in the future. Um, Personally, I've realized that I really do miss my family. As much as I like to work, it's been quite some time here, and I do really miss going back home, seeing my parents, my brother, and my dog. So I think that's the biggest thing, that I really do miss my family. So I think in terms, I think Canada's done a great job containing COVID-19, um, and especially Ontario, the Ontario government has done quite a bit to make sure we can ramp up our testing. But I think at the end of the day, it comes back to preparedness. Hospitals, like since SARS, we should have developed more stringent protocols when it comes to um, protecting ourselves and maintaining social isolation and social distancing in terms of a community. But in terms of healthcare, we should have stocked up on our PPE. I understand that certain PPEs do expire, but I think countries around the world, or even provinces in Canada, should collaborate to see how we can constantly keep a stock of PPE. That's the first thing. Second thing is the fact that we should have had a digitalization of healthcare much earlier, because now doctors are doing online consultation with patients and telephone consultations. Now, I understand with telephone, I understand with online you could do quite a bit, but I'm like, with telephone, there's not a whole lot that I could do in terms of consulting. But if we've already had tools in place, for example, if we had a BP cuff monitor that could directly speak to our central healthcare network, then I could see that in real time. It costs a lot of money and it does cost a little bit of investment at the beginning from the government. But digitalization of healthcare would have helped this process to be much easier, because you could have family doctors see their patients earlier. Patient follow-up could have been earlier, but it's just the fact that the government must invest in it. Because you cannot invest in more ICU beds and build more hospitals. That's not a viable plan. It costs a lot of money. But the viable thing to do is making sure that our public is aware of these things, have proper protection, PPE, and social isolation protocols as backup emergencies. And the third thing would be digitalization of healthcare. And if we do all three of them, maybe the next pandemic would be much better.